First of all, I would like to thank the organizing committee for inviting me to take part of this webinar. It's a great opportunity to share with you our experience during the COVID pandemic, and more specifically, how we had the opportunity to evaluate the patient experience during this period of time. As probably many other hospitals in Europe, we attended a large number of patients in a short period of time. You can see here that in between March and June, we attended approximately 2,500 patients hospitalized by COVID-19, 20% of them requiring hospitalization in critical care unit, and the mortality rate was approximately 8%. Not only these figures are really impressed, but at the beginning we were concerned about the rate of hospitalization that we need at the beginning of pandemic. You can see here that from March 15 to April 1st or 2nd, we achieved a number of approximately 1,000 patients admitted in our hospital. That is a schematic representation of our hospital. You can see here that we had 35, or we have 35 hospitalization unit. That is the picture before the pandemic. And just 1 month later, the panorama changed tremendously. You can see here that we increased 8 units, converting, for example, our hemodialysis unit or the surgical theater or pre-admission unit in conventional or critical care unit. You can see here that approximately 3/4 of our unit were devoted to patients with COVID. But we don't have enough with our hospital, and we have to require other facility, for example, a hotel that were closed to our hospital, and we have to convert in a fully medicalized hospital, like it is like a community hospital, because we have to convert rooms, install and setting up oxygen. We establish a pharmacy or other facility within this hotel. We were really concerned about the experience of our patient during this period of time because of two main problems. First, because we consider that the magnitude of COVID turned other clinical problems into invisible disease. Almost the whole hospital was devoted to COVID. I mean that other patients were afraid of coming here, and probably we are not attending them properly. The second concern was about the isolation. You can see, you know that these patients are isolated in a single or double room, and we were not admitting families to visit them during this period of time. That means that isolation was a big concern during the pandemic. We have the opportunity to evaluate patient experience in 3 different aspects that I'm going to summarize in very, very shortly. First, we evaluate the experience of them in this new facility that we are using, the health hotel that we call. That is, as I mentioned before, is a hotel fully medicalized that we admitted them. There were approximately 500 patients, and was an alternative to hospital at home, or we use for early discharge from the hospital. And sometimes we also use this device or this facility to support for lockdown in patient that has difficulty to follow it in his or her home. In this facility, we evaluate the experience of our health professional. The experience were was satisfied for them. That you can see here that they recognize that they could self-organize work, and it was a great opportunity to work in an interdisciplinary manner. But all of them recognized that probably the hardest part of their job in the hotel is to take care for isolated patients. We also evaluated the experience of our patients in this facility, and you can see here that approximately half of them were fully satisfied about the way that we provide health support in this facility. But half of them recognize that we can do that there is room for improvement, for example, about food, housekeeping, spaces, or medical attention. The second concern that we have during this pandemic was about the psychological needs of our patients. You can see here that the needs were different. Sometimes there is some patients suffer some significant emotional disorder, especially at the end, those that are facing the end of life situation. Sometimes it's not the patient, it's the family of this patient that need psychological support. And sometimes are also our professionals, our health professionals that need support or training to face these difficulties. We were taking care of these psychological needs through our section of health psychology. In other cases, our professionals need a more individual psychological support and sometimes even psychiatry medication, and was provided by our psychology and psychiatry department. Finally, but not less important, because of the isolation that I mentioned before, most of or more patients, a lot of patients cannot contact with his or her family due to physical or technical limitation. And for that, because of this condition, we started a program that we call Shortening Distance. That in brief is just to provide some support, and sometimes providing a cellular phone or sometimes a phone charger to patients to perform or to set up a phone call to his relative. Sometimes the patient is not able to hold the phone, and in that cases, a member of the program helps the patient to set up the phone call. This program was evaluated and the patient considered that they were very satisfied about the program because they considered that is a good way to improve the communication between patients that are isolated in the hospital with their families using informative or communication technology. But interestingly, there are patients that consider that they didn't want to communicate with family, and even in some cases consider that communication has adverse effect. I mean that it is really important to evaluate the patient's experience after any program or any maneuver that we perform in order to improve the health support that we're providing to them, because sometimes the conclusion were a little bit contradictory. And finally, we evaluate also patient experience in a more regular manner. We were performing focus groups of 7 to 9 patients using video conference because we considered that probably during this period of time was the most effective way to communicate with patients. There was a chairman that is not known to patients, and also the physician responsible for this kind of patient, for this specific group that we are attending. And the length of the focus group is approximately 1 hour. We do a very systematic methodology, but I just want to emphasize that we perform the focus group using video conference, and also that we provide feedback to patients, and also we send to them an electronic survey to evaluate how they experience the focus group. It is really important to give feedback to patients after each focus group, just summarizing a little bit the main topic, the lesson that we learned, and the conclusion, and emphasizing the next step that we are going to take, and also, and probably is the most important to thank to them for participating. Just very briefly, that is a summary of some of the experience that we evaluate. We perform around more than 1,500 surveys after the focus group, and we have a response rate over 60% that is pretty good. And probably the most important conclusion in all groups is that the lockdown obviously impacted the social and family relationship. We evaluate a focus group of patients with chronic headache, and they said that approximately 80% of them has symptoms during this period of time of equal or magnitude, a little bit better than that they experience usually. In a second focus group, we evaluate patients in dialysis or receiving a kidney transplant, and the majority, almost 100% of them, were aware that they are a risk group, and they considered that was really important to try to keep daily routines. And finally, we evaluate another group of patients with obesity, and they consider that during the lockdown, approximately half of them gained weight, 2/3 of them changed the eating habits, and approximately 80% reduced the physical activity. Finally, we evaluate in a focus group with patients with chronic disease, what's the information that they need during this period of time. And you can see here that they consider that they receive too much information, probably from the media, that we call infoxication, because the overloading of information from multiple sources, that they have little trust in media and social media. They consider it, at least that is a situation in Spain, I'm not sure that in other countries in Europe occur the same, that the political struggles affect the information. I mean, that was not, or that the information could be biased because of political reason. And probably the most important information for us is that even though we make a tremendous effort to provide a lot of general information in the research that the hospital is taking care in COVID, the patients consider that they need more practical information. Thank you very much for your attention.